Dr. Wagle, thank you so much for your time. You're somebody who I know a lot of the city is actually consulting with on, especially on COVID cases, and I just want to get a few things that I feel a lot of people are kind of thinking now and asking. And I think we've crossed over, we've crossed over 9 months. We've gone into the new year.
Yes,
Season. We knew so little in March, and
yes.
obviously we still don't know as much as we should probably, but we have learned so much in the last 9 months. So
Yeah.
I want to get a quick. I just wanted to ask you for a quick update on what have we learned in 9 months about COVID, right? So I think. I mean, if you can just keep it simple for the layman, for a patient, like just imagine talking to one of your patients, and so you're talking to me, you can think of the fact you're talking to one of your stupider patients. So just to break it down and explain it to us, what have we learned?
I think one thing which I have learned is, I think, humility, mainly because, this virus took us by surprise. We really did not know what we were doing in, say, March, April. We were floundering quite a bit. And I think for the last 5 to 6 months, we are now fairly sure what we are doing and what works and what does not work. Now we know that what works, lot of things which we were trying earlier doesn't work. Similarly, we know now that how it is transmitted fairly surely, so that we know that mainly it is the respiratory route, and therefore masking will reduce most of the things. Fomites are not that important, which we see. For example, in March, if I look at myself, I was more bothered about washing my hands than wearing a mask. Now, I'm much more bothered about wearing a mask and washing hands whenever I'm touching other surfaces. Yes, but not as much as I was bothered before. Second thing, we do know that in 50 to 60% of the people, it is asymptomatic, and it's a very very mild disease. 35% it will be even milder disease, and only 15% end up in a hospital. I think for me, one of the most important thing is we know that whatever we were using earlier, quite a few things were futile, were doing more harm, and as a result, we know there are only few things which work, and that has been the main important uh, learning process. We still do not know post COVID symptoms, how to treat them adequately. Post COVID, as you know, I mean, you might be aware that a lot of people, after they recover from COVID, they continue to have some symptoms.
Right.
Some people will feel tired, some people will have cough, some people
Yes.
will have throat irritation, and which may continue almost for a period of 2 months or so.
Right.
Do know that they are not psychological, but we do not know yet how to treat them.
Is it clear now that it is very unlikely for the disease to transmit through inanimate objects? Is that the first thing
Yes,
that?
it is very unlikely. Yes, you are
Okay.
absolutely correct.
And so therefore now when you go to public places, etc., and if you are holding handrails or touching elevator buttons and all that, when everybody was so concerned about those things, now we're seeing that look, those holding, wearing a glove and touching the buttons, those are not the likely ways. It is still basically your respiratory system. So therefore you have to keep your nose and mouth and ear and
Absolutely. So, I mean, the thing would be that, as you said correctly, that masking is more important, and, this touching other places, as long as you wash hands sometime, in the sense before touching your nose and your face, that's what we want to do. But the chances of transmission through inanimate objects.
Then the second question that I wanted to ask after this is now the post-COVID. We are hearing from most people. I mean, what I last heard months ago when we discussed this was that after you recover from COVID, 3-4 months you need to give your lungs serious rest. So you just have to be. You don't work out. You don't go for walks. You don't. You don't do anything very physical. Is this still what we are believing now?
So I think this can't be generalized. As I told you, almost in 85% of the patients, there is hardly any, no, they have mild illness. And I don't think these patients will have to anyway change their behavior post COVID. I mean, those people who get seriously involved, that means their oxygen saturation falls and they end up in a hospital. Of course, there is going to be some lung involvement, and these are the patients. will have difficulty in getting back to normalcy. And in those patients, yes, we need to give the lung rest and slowly increase their activity.
Okay, now when somebody is got COVID symptoms, what we're hearing in several situations is that they are immediately either being prescribed or they are self sort of medicating by taking by immediately starting steroids and antibiotics. I just want to get a sense from you, on the just the common misconceptions on COVID treatment. Advise people to now that of COVID, how do you take it?
So basically, we somebody tested COVID positive, whether this patient requires hospitalization or they don't require hospitalization. That depends on the patient's comorbidities, as we call it. So whether they have a heart disease, kidney disease, severe
Right,
immunocompromised state. So I will restrict myself at least to the people whom we are going to treat at on an outpatient basis and at home.
right.
If we do that in these patients, frankly, there is no specific treatment required.
Okay.
What is required is a close monitoring wise. There are only three things we tell them to monitor. Number one, the temperature. Number two, whether the oxygen saturation oximeter rather than by any app and in a sitting position. And third thing is their own perception of breathlessness. These are the cues for us to transfer this patient to the hospital.
Right.
As far as your question, antibiotics don't work. A lot of people are using azithromycin, doxycycline. They
Yeah.
don't work. So now, doxycycline is one of the drugs, one of the antibiotics, which is thought to have some antiviral property for many, for ages. And it in everywhere it has been tried, just like FCQS has some antiviral properties and has been tried with every new virus which comes. So all these things have been ineffective.
So when you fall ill, generally it's
Yes,
either a virus or
correct.
and the
Antibiotics.
it's a viral disease. How do you treat it?
So you treat with antivirals. Now, as far as the antiviral which has been shown to be of some benefit is remdesivir, which is an intravenous drug to be hospitalized patient. So
Right.
if somebody in first 7 to 10 days, then yes, we do give remdesivir. But remdesivir is not a treatment to be given at home. Antivirals, for example, favipiravir has been has been touted as a antibiotic which we useful, but not a single study has shown that it does any good. Frankly, for a person who is at home, it is mainly treating the symptoms.
Okay. And that is how that is your basic
So
your
in
your,
case of
your ghar ka
fever,
Ayurvedic
you
stuff.
give paracetamol. If you have got too much amount of cold, then you can give antihistaminics. If you get some throat irritation, then you give something to soothe the throat or suppress the cough. I mean, one needs to really understand that there are very few viruses, Anant, which we have got any treatment for,
Right. Okay.
and COVID is no different. Remdesivir has been shown to be effective in patients, but again, there also the data is very iffy.
Right.
But in an hospitalized patients, one would use whatever one can get to reduce the severity of illness.
If you feel COVID symptoms,
Hmm.
what is the playbook? What would you do? When do you think the patient or the family needs to press that panic button and actually call a
So that's what I
doctor?
said, that we need to monitor these things. One is if the saturation, oxygen saturation is persistently goes below 94%, if the person starts feeling more breathless or has got significant, very, very severe cough, or the temperatures go really very high, so then this patient needs to be admitted. Obviously, there are other things also that we do check the blood parameters to see what is the level of inflammation. And if the inflammatory markers are very high, then also we suggest that the patient should be admitted in the hospital.
the question is, now we're hearing a lot of cases where patients who have been diagnosed with COVID, or they've got COVID symptoms, they are self-medicating, and what they do is they are taking a bunch of antibiotics, paracetamol, as well as steroids, and they just kind of take it all together. And then the symptoms reduce, and they kind of feel like they've improved. And what we hear from you is that that's not the best playbook to.
Correct. So, I mean, one of the largest studies carried out by WHO did show us that steroids are useful only in those patients where the oxygen levels fall.
Right.
And they are harmful if they are given in a patient whose oxygen level is normal. So, somebody who is at home is not hypoxic, his oxygen levels are normal. And you are potentially doing harm if you give steroids to these people.
So, what does the steroid do, and how does it harm?
Yeah, so steroid will reduce the steroid is a basically reduces the immunity, reduces the enhanced immune response. So therefore, it makes you more prone to getting some other infection.
Okay.
On the other hand, when oxygen levels fall, that usually means that the inflammation in the lungs is so high that the benefit of reducing that inflammation is much higher than compared to the risk of the steroids.
I get it.
It's always in medicine, it's always risk benefit ratio.
Yes.
So if somebody is hypoxic, steroids will be helpful. In fact, that is the only therapy up till now which has been shown to reduce mortality in a hypoxic patient.
The mortality in India has consistently been proven to be a lower number than all over
Yes,
the rest of the world.
yes.
Why is that? I mean,
I have no explanation. I really don't have any explanation. I think God has been kind to us. I suppose maybe we are getting a less virulent strain. We had a very strict lockdown earlier, and thankfully because of that it gave at least the medical fraternity time to prepare, because if these the things that started with a bang right in the beginning, I don't think we were prepared enough to deal with the onslaught. And then I think, I suppose, because of the economic reasons or whatever, we kept on relaxing the lockdown. Numbers were going up, we were still relaxing the lockdown. And but now the cases are coming down.
yeah.
So I really do not know. I don't have a complete explanation for this, because countries, I think they removed the lock. They lifted the lockdown when it was scientifically indicated that the limit. Still, the cases are going down, and as you said correctly, right from the beginning, our mortality rate has been significant. Case fatality rate, and also if you look at the mortality per million, has been one of the lowest.
Yeah.
I think we are lucky.
One of the things we keep hearing, and one of the theories that we keep hearing about, is the fact that because we are so densely populated, herd immunity came in faster, and it reduces the viral
Likely,
load.
likely.
So the viral load, now what now? Is it fair to assume that the viral load has actually reduced? That one progress that we have actually made, or is that something we don't know?
I think there is no scientific study for it, but I would definitely see that's what is happening now. Because I mean, I am from Bombay Hospital, and as we have shut down half our COVID beds. Number of admissions have gone down, and I am been talking to my colleagues in the city. Everybody says the same thing. The number of serious patients have gone down. So maybe you're right that the virulence of the virus seems to be going down.
Would you still say that we have to, maintain, like if you're outdoors, you have to still have the 6 feet distance, still keep your masks on? I mean, all these things that we've been saying since March are still as valid today as they ever were, right? We're still
I
not.
would think so. I would really think so, because but I mean, I think maybe I have a worse perspective, because I have been looking after these patients, and I know what harm it can do.
Right.
This virus can do real harm. So I think, uh, even though now I think the things can become normal, I would still advise wearing a mask, and with somebody whom I mean, anybody outside your household, I would say you wear a mask. Now, your question about outdoor thing, it's a bit difficult. So, if you are going to be outdoor, maybe, but in India, though the the streets are so crowded, I think to maintain a 6 feet distance is well nigh impossible. So and I would still say that going to a, I wouldn't go to a restaurant.
A follow up to the question that we had asked earlier. Again, I'm a patient. I've come to you now, and I want to take the vaccine, and we,
Yes,
for whatever reason, believe that we should.
yes.
Which vaccine should we be taking?
See, at present in India, we have got two choices only: Oxford AstraZeneca vaccine, and we have got Covaxin by Bharat Biotech.
Yes.
I don't think we have mRNA vaccines. Both Pfizer and Moderna are not yet available in India. As far as the current situation is concerned, the only vaccine which has shown to which has finished the phase 3 studies. So phase 1 and phase 2 studies are about the safety of the vaccine, and phase 3 study is about the efficacy of the vaccine. So only Oxford vaccine has finished the phase 3 studies, whereas Bharat Biotech vaccine has started the phase 3 studies from November. So I think it will be at least 3 months before we get the efficacy data. So I think we would expect the efficacy uh, data by March. So currently, I think even though there are two vaccines, I think really speaking, you have got only one vaccine which has shown efficacy. Having said that, theoretically, I find the Bharat Biotech vaccine theoretically, much more interesting. It's a standard approach. Not only that, it will give rise to both B cell immunity and the T cell immunity as well. So it is very, very interesting. But we do not have the efficacy data as yet. And it's a standard approach. We know that this particular approach has been tried before in multiple vaccines, and it is found to be so. They have got a killed virus which is combined with algel and some other immunostimulant products. So it gives rise to both immunity towards so-called spike proteins and also the Th1 immunity. So it's a very interesting vaccine, but currently they don't have the efficacy data. So on 6th of January, if you ask me which vaccine to take, I think we have a choice only one. That is your Oxford AstraZeneca virus.
And if you have the resources to be spoiled for choice, that is to travel and get vaccinated, which a lot of
Yeah,
people are
yeah,
thinking
yeah,
about now.
yeah.
And then you have access to Pfizer, Moderna, Covaxin, as well
Yeah,
as
fair enough. Okay. But
AstraZeneca.
answer to that question is currently, if I have a choice, then I would take a Pfizer vaccine because Pfizer vaccine, first of all, has already been used more than 3 weeks now in US. So we have a real world data. Second thing, Pfizer vaccine and compare difference between Moderna and Pfizer efficacy wise, Pfizer is the only one which has been shown to be effective in people who more than the age of 65. So it is throughout. Main problem with Pfizer vaccine is the storage minus 70 degree.
Yes.
So if that is maintained currently, if I have a choice, I would take a Pfizer vaccine. This particular vaccine is the mRNA which gets encapsulated in different molecules. So you have to be sure that you are not allergic to any of the main side effect of this has been an allergy.
Yes.
So they have got what is called a PEG is one of the compound. There is some lipid. So you have to be sure that you are not
Allergic.
allergic to any of them. Then yes, I would take Pfizer vaccine because that's the only vaccine which we have some sort of a real world data.